Basic Postulates of Care Coordination by Amber Jackson. Introduction to Health Collaboration. Care coordination is a patient-focused planned process which coordinates care activities and sharing of information. It is instilled in the everyday nursing practice in terms of communication, education, and advocacy. Patient outcomes in the general patient and family experience are enhanced by proper coordination of care. Concepts of care management. The coordination of care should be patient and family centered in order to observe the values and preferences of individuals. There is a need to have interdisciplinary collaboration to avoid gaps and repetition of care. Cohesion between healthcare environments promotes effective transitions to care. Decision making based on evidence favors quality and safety of the patient. Collaborative plan support. The patient and family interaction enhances treatment plan adherence. Culturally responsive education minimizes medication errors. Education should be coordinated to facilitate chronic disease management. Such measures minimize complications that may be prevented and enhance outcomes. Patient experience and change management. Effective communication in the process of care transition improves patient anxiety and confusion. Trust is created when change is managed properly and the patients are ready to undergo the next stage of care. The care coordination has to strike a balance between sharing the information and patient confidentiality. Nurses are important in transition and follow-up care. Adding to standard and patient-based care. Patient safety and continuity of care is enhanced by effective change management. When patients have knowledge of their care plan, they will better placed to be self-managed. Emotional support improves the experience of the patient. Nurses offer the aspect of consistency as they strengthen education and resolve issues. Rationales of care management plans. Organized care plans Organized care plans are based on moral values in nursing. Beneficence helps nurses to do in the best interest of the patient. Non-maleficence is aimed at harm prevention by preventing harm by means of safe coordination. Autonomy respect guarantees participation of patients in care decision making. Implications and presuppositions about ethics. The care plan adherence can be influenced by access to transportation and caregiver support. The economic constraints can affect the treatment. Care planning has to take into account social determinants of health. The nurses have to promote fair treatment and maintain confidentiality. Effect of health protection policy on health collaboration. The policy of healthcare determines the way the care coordination is provided. The value-based care programs are aimed at enhancing outcomes and minimizing readmissions. Follow-up and discharge education is promoted by transitional care policies. There are clinical guidelines that enable evidence-based standardized care. Results and experience policy implication. Care coordination enhances quality measures which are policy driven. There is increased patient outcome accountability in healthcare organizations. When care is coordinated, patients report increased levels of satisfaction. The coordination led by nurses will lead to a reduction in the total healthcare costs. One moment. Sorry about that. Results and experience policy implications. Care coordination enhances quality measures which are policy driven. There is an increased patient outcome accountability in healthcare organizations. When care is coordinated, patients report increased levels of satisfaction. The coordination led by nurses will lead to a reduction in the total healthcare costs. The duty of a nurse in care management. Nurses become patient advocates during the care continuum. They offer education which facilitates informed decision making. Nurses interact between disciplines and care environments. They safeguard patient privacy as well as continuity of care. Nursing practice, resources, ethics, and policy. The nurses should be able to utilize resources effectively but engage in ethical practices. Knowledge on healthcare policy enhances care coordination. Patient-centered decision-making is advocated by ethical leadership. Nurses promote changes in care provision at the system level. And that concludes my presentation. Thank you.